So the waiver-based options, there are several different directions you can go. They have shared living models, which are a host home or a companion model, and then self-directed supports, an ISL, which is individualized supported living, which is different than what Beth talked about. Hers was an ISLA, and that is for independent supported living arrangements. So an ISL and or a group home. And I'll talk about the differences between those two coming up. The services that the St. Louis ARC provides mostly are an ISL, our group home. We have a couple of host homes, but we don't do those on a regular basis. There's other agencies such as Momentor, and probably others, but Momentor is a big agency who really delves mostly and a lot into host home models. So there's a difference between a host home and a companion model. And the differences basically is that in a host home, you would be living with a family in their home, and they would be providing supports and to your family member or to you. And the companion model is when a person is living in their apartment or their home and they're welcoming somebody to come in to live with them that helps provide supports. I don't know a great deal about those services, but those are out there as part of the comprehensive waiver. Then there are self-directed supports and services that you can receive on those, or personal assistance, medical personal assistance, behavioral assistance, community specialists, money for a support broker, which is the person that you hire to help provide the services and the information and assistance that you need for the self-directed funds. I have websites on here that you can look at to gain more information in those areas, but just a little bit of information about the self-directed supports is that it's based on the principles of self-determination, people making their own decisions of what they want and what they want it to look like. You are the person, are your designated representative. You're kind of like the employer and the budget authority. You're hiring the people, you're training them, scheduling them, and firing them if people aren't working to your expectations. And that you have a budget that you're using with the money that is provided to be able to pay for those services, whether it's direct support or one of the other ones we talked about earlier. Obviously, you have to follow the laws such as any other employer. And the 6 components that it includes are person-centered planning. So you're probably accustomed to person-centered plans at this point in time. Or an IEP. They're all very similar. ISP is just really looking at you as an adult, and the services that you need and what they need to look like are all outlined within that person-centered plan. Individual, you control the budgets, and there's help from a financial management company, and having backup plans in place is really important because staff don't always show up. And you need that backup plan to be able to ensure that your family member is getting the support that they need. So go on to the website, the DMH website, to look at more information in those areas. So the individualized supported living is supports that's provided in a person's home. And it's determined that this home and this way of living is the least restrictive environment possible for you. You choose where you want to reside, the home, which has to be either owned or leased by at least one of the residents who is living there, or by a family or guardian. Agencies are not the owners. They do not sign the leases on these apartments. And the other thing that you will decide on is whom you want to live with, and it can be up to 4 individuals living together. So it could be you and 3 other people. Your benefits are utilized to cover the room and board costs. So room and board, your rent, your utilities, your food, house supplies, is how those costs are paid. And then the comprehensive waiver covers the costs for all of the staffing, the health and safety needs, and administrative costs that go into that rate. And into that budget. And the budget is created for each person by the agency using the hourly rate provided by the MAS assessment. So before we talked about the MAS assessment, and that assessment is going to provide an hourly rate for an ISL. And it's based on what the score is for your assessment. And those rates will vary from if you have a score of 1 to having a 5. I'm going to talk about services and what that looks like after I talk about the group home, because services, as the St. Louis Arc provides, an ISL and group homes look very similar, and the philosophy of how we provide those services are very similar, if not the same. So a residential group home is a group of people who are living together where there's, well, it used to be 4 or more individuals. Now I think it's really more like 5 or more individuals who are residing together with staff support. The household expenses are divided among the individuals who are living in the home. And the daily rate is based on the individual's MAS score. So the difference between a group home and an ISL is the budget. The budget is created individually for each person in an ISL, and in a group home, based on that MAS score, there is a daily rate from a score of 1, which is like $287 a day, to a 5, which is going to be a lot more for that daily rate. And that money comes in, pays for all the same things that we talked about in the previous slide for the ISLs. So what do the supports look like? So the first thing with both an ISL and a group home is the basic health. We want people to be healthy and safe. Those are the first 2 things that we want to assure. We support people in going to their doctors, scheduling all of those annual exams that need to be taken care of, dental, and just day-to-day support of one, passing the medications, ensuring that all the staff are trained to pass those medications. So people do not have to be able to do those things themselves, and that is one of the things that the staff will do. Activities of daily living. So that whole idea of, okay, it's I get up in the morning, I go to work, or I go to some type of day service, or I'm home during the day and I do volunteer work. So the staff will assist your family member in getting to those, 1, getting up in time if they need support with their hygiene or any other tasks that they might be completing in the morning before they would go to work, or to the day program. Then staff are there to support your family member. And the same thing when they come home. So it's to assist them. It's not to do things for them. We're not there to do everything for each person. We want everybody to live as independently as they can and continue to gain skills to be able to direct their lives, make decisions, and be good advocates for themselves. We want to ensure that people are getting out to do the things that they're really interested in, whether that's going to ball games or going to the movies, go out to dinner, going for walks and getting exercise, going to the YMCA, a whole variety of different activities that where the interest of your family member is most important. And social supports, it's really important for everyone to have friends, to be able to contact them, set up plans. We want them to continue to see their family, because families, we're not taking over the family's responsibilities or relationships. We're there to assist the individual to live in their home and do the things they want to do. But that family involvement is very different for each family. Some people go home every weekend. Some people, go home for holidays and have gatherings for birthdays and each of those different holidays. So it looks different for each person. And whatever works best for you as your family is how we want to support your family member. We support your family member, but we also support you and those relationships. If if you are the person's guardian and family, and your family member is okay with you receiving information, we share the basic and all the health information, what the doctor's appointments and individuals have gone to, and sharing that information. If there's medications that have changed, letting you know that. And definitely, if you want to continue to provide those supports to your family member, that's okay too. We just have to be involved in the process because one, we're the ones that have to implement whatever the doctor orders. And, the staff in the houses have very much become the eyes and the ears of your family member.